Now then, in order to see clearly, like Johnny Nash, that the rain is gone and, well, you can see all the obstacles in your way, you need to take care of your eyes. Why am I telling you this today? Well, it's National Eye Awareness Month, and the aim is to raise awareness about the importance of eye health, so specifically around the prevention and treatment of avoidable blindness. Dr. Thekiso Selele is an ophthalmologist. He joins me now live to tell us more. Doctor, pleasure having you on the program. Happy Heritage Day.
Good morning, Blaine. Good morning to your viewers. Happy Heritage Day to you too.
Look, eyesight, one would say, is one of the most precious gifts to a human being, but unless we get regular checkups, we might not even know that we are in danger of losing our sight, correct?
That's correct, Blaine. And just to give a bit of context in terms of visual impairment and blindness, obviously it's one of the leading causes of disability globally, and it's obviously a key barrier to access of education and employment. There's several studies that have shown that there's a strong association between access to visual or eye care facilities, your social economic conditions, and visual difficulties. In South Africa, according to our National Department of Health, the prevalence of blindness is 0.75%. So that means just over 400,000 people are living with blindness in South Africa.
Right.
And of these cases of blindness, about 80% are avoidable, meaning that they could have been prevented via prevention or treatment.
Yeah.
And when you look at these causes, the main causes are undiagnosed refractive errors, where patients can be corrected with some glasses. You can also have cataracts and glaucoma. So those are your main causes of blindness that we struggle with.
So you're saying there's about
the Eye Awareness Month is what the South African government is part of their health awareness activities.
Yeah.
It runs every year in the third week of September. So from the 21st of September to the 18th of October. And as you stated, the aim is to educate people about the importance of eye care or eye health, and to encourage people to go have regular eye care visits at least once every 2 years.
Something that jumps up.
So anyone with any visual difficulties should not really hesitate to access or seek help, which is readily available, in private and public facilities.
Right.
So, in support of this initiative, there are definitely things that are happening. I mean, for example, at our practice, which is based at the Life Brain Test Clinic, we are offering screening for common eye conditions, which include cataract, glaucoma, and diabetic retinopathy. And I'm practicing there in association with Dr. You may know him. He's the first African to qualify as an ophthalmologist in South Africa. And then obviously the Gauteng Department of Health, which I'm more familiar with, they are also running events during this period. They'll be running education and screening activities at clinics. They'll also be doing engaging with community radio stations, and also during this time they do have what we call the Cataract Marathons, where they try to address the backlog of cataracts, and this has obviously been by the COVID and the lockdown.
Dr. Thekiso, I'm just checking if you can hear me. Can you hear me? All right. It seems that I lost. It seems that we lost. We did lose audio with Dr. Thekiso there. Doctor, you still can't hear me, right? All right. So yeah, it does seem that we lost audio with regards to this interview. But basically, the doctor was saying between 75 and 80% of all cases of blindness is avoidable. We'll try and bring in the doctor maybe later on to get more on this very, very important issue indeed. Let's take a quick break. I'll get you more news at the top of the hour.